Amiya Jenkins, and I'm a first-year student here at the University of Maryland School of Pharmacy, and I'm expected to graduate in the year of 2028.
Hello, I'm AJ Pasqualini. I am a second-year pharmacy student, a part of the graduating class of 2027.
Hi, my name is Dionne Forbin, and I'm a third-year pharmacy student at the University of Maryland School of Pharmacy, and I'm class of 2026.
My name is Taraneh Mousavi. I'm a pharmacist and currently a first-year PhD student in pharmaceutical health services research at the University of Maryland, Baltimore, class of 2028.
10 years from now, I would like to see myself working within my preferred field, that being pediatrics. Hopefully already having my board certification and definitely in the process of opening up my own clinic where I'm able to help families that are less fortunate and give them the best treatment possible, whereas they may not have been able to receive it at large hospitals or other type of companies.
10 years from now, I'm hoping that I can be within an academic setting. My big goal of mine is to get involved in academia, so I'm looking to do residency right after graduation, and then hopefully I could become a lecturer. It would be great to come back here, but really any school that would be willing to take me and be a head professor there.
Where I would like to be 10 years from now is in a leadership role in clinical pharmacy. I would like to be a part of more patient-centered care projects and be involved in medication safety and health policy since I've had a passion for those early on in my pharmacy career, as I have been a part of the Maryland Poison Center as an ambassador teaching about medication safety, and from just the research projects that I've completed with some of the pharmacists outside of pharmacy school. And I also hope to see myself interact with future students, pharmacists, and make the field more diverse and more inclusive for those moving forward. I felt that I would be more a part of like an interprofessional team where I could talk to the doctors directly, let them know my input, they understand where I'm coming from, and then also interact with the patients myself directly so they know exactly what their hospital stay was all about, what exactly the medications they were taking, the difference between their home and inpatient medications, and then hopefully I can teach that to future students.
10 years from now, I see myself as a leader in one of the pharmaceutical companies in a department of clinical research or pharmacovigilance or health economics and outcomes research. And I'm specifically passionate about being a leader because I do love being an initiative and doing some further steps and making some positive impact in the future of patient care, specifically in the fields of neuropsychiatric disorders and cardiovascular diseases. If I want to talk more detailedly about my future, I want to somewhat be at the intersection of clinical informatics, patient safety, and then real-world evidence, making sure that our treatments not only meet the regulatory standards, but more importantly, provide a tangible benefit for our patients in the real world. So I plan to also put a specific focus and patient centricity in both clinical trials and post-marketing surveillance, because I believe that understanding the patient needs and preferences would be a key for the future success of the pharmaceutical industry and the healthcare system as a whole.
Two of the biggest things that I know that is hindering the field of pharmacy is drug costs and labor shortages. For example, I know there are many people in the world who struggle to decide if they're going to pay for their medication or pay for their bills or their lights or their housing. So I know that's definitely a big thing. So I know for me, I would always try to find the best medication that they're able to afford and definitely continue to advocate for the patients, because the patients need someone to speak on their behalf when thinking about lowering the drug costs. And then the second one being pharmacy labor shortages, where where pharmacists are unable to give patients the best treatment because they are having to shorten the interactions between the patients. So I feel like if we are able to continue to advocate for the patients and have more pharmacists come in and be able to treat more people, then we're able to give them the best line of treatment and be able to cross every check mark and cross every T's, dot every I's that are needed to make sure that the patients are able to take their medication properly, make sure that they are getting the right medication that they need, make sure that there are no drug-to-drug interactions, and pretty much just give them the best treatment possible. Essentially, burnout is a big problem that not only pharmacists, but many healthcare professionals or even anyone working has to interact with. But speaking only on pharmacists, if there was more pharmacists able to treat more patients, then we would be able to give patients the best treatment possible. We're able to give them the proper instruction on how to take the medication, what they should and should not do when taking the medication, any potential drug-drug interactions that could potentially occur if they were to get on more medications. But if we had many patients that we had to interact with, we would probably be unable to give each individual patient that individualized treatment that they definitely need. So yes, burnout is a big problem. Hopefully later down the line, we will be able to hire more pharmacists within these hospitals and within these clinics so that we can treat more patients and also give them the individualized treatment that they all deserve.
There are many challenges that pharmacy is now facing, such as staffing shortages and corporate pressures. But from my experience of working both in a retail and hospital setting, I've seen how adaptable and resilient my pharmacists have been. And so that's motivated me to become part of the solution. And I see that with pharmacists, we can expand our clinical roles into public health positions to just support the overall well-being of our communities moving forward.
A big change coming to pharmacy is introduction of automation and trying to add artificial intelligence into things. I think in the pharmacy field, one of the biggest things is compassion and empathy that pharmacists have for their patients and those around them. One goal that I have when I graduate from here is trying to continue that passion and that core underlying element of being a pharmacist to make sure that no matter what patient interaction happens, it's always going to be filled with any sort of compassion or empathy for that patient to make sure that they're getting the best possible care.
As we all know, currently the pharmacy profession has many challenges, including but not limited to workforce shortages, increased healthcare costs, reimbursement issues, growing patients' needs, and then issues regarding medication management complexity. We already have issues in the field of healthcare disparities, like variations in treatment outcomes, social determinants of health, and then unequal access to medications. If we want to also discuss this question from a broader perspective of the view, we can say that the pharmacy profession today is not just about dispensing medications, but more importantly, it's about collaborating with different stakeholders, ensuring that they have an optimized decision making for our patients and everyone have equitable access to safe and effective medications. Indeed, all of these are challenges, but I see them as opportunities for us as pharmacists to somewhat find the innovative tools and adapt new mechanisms to somewhat keep the balance between the rising patient demand and the resources we already have. If I want to provide you with an example from the healthcare services researcher perspective of the VU, one of the major two advancements in this field are about real-world generation and utilization, as well as the artificial intelligence. Both of them are a powerful tool that I believe they can be a milestone in the future of pharmacy in every stages of research, drug design and development, clinical trials, post-marketing study, and then the clinical practice. Obviously, both of them can make the practice of pharmacy easier for us. make us to better understand the treatment gaps, improve the accessibility, and address the affordability issues. From another point of view, artificial intelligence can overcome the issues with workforce shortages. So all in all, as a pharmacist and as a healthcare services researcher, I truly believe that the future of pharmacy somewhere lies in the integration of real-world evidence and artificial intelligence, focusing on patient centricity in research and then addressing healthcare disparities.